Castle Point and Rochford Health and Wellbeing Strategy Reset, Physical Health Workshop from the 9th of September 2020, facilitated by Dawn Emberson, who is the Relationship Manager at South Essex Active Essex. Emerging themes within physical health: levels of child and adult overweight and obesity, trends in physical activity and inactivity levels, prevalence of long-term conditions such as coronary heart disease, stroke, diabetes, hypertension and dementia, incidence of vaccinatable diseases, hospital admissions due to falls and hip fractures in older adults, chronic obstructive pulmonary disease, also known as COPD, stroke, and coronary heart disease, also known as CHD. Questions to consider as you look at the data. 1. What does the data tell us? 2. What do you think are the key priorities and how should we be addressing them? 3. What additional issues or effects has COVID-19 had on physical health and how might it paint a different picture to what we see here? Levels of overweight and obesity in Castle Point and Rochford. Just over half of adults in Castle Point at 50.5% and Rochford at 54.6% are meeting the 5-a-day recommended intake of fruit and vegetables on a usual day. A fifth or 20% of reception-aged children in Rochford and nearly a quarter or 24% in Castle Point are overweight or obese. Over a third or 35% of Year 6 pupils in Castle Point and 27% in Rochford are overweight or obese. 2/3 of adults in Castle Point and 63% of adults in Rochford are overweight or obese. Dawn Emberson commented on this saying, "We are hearing anecdotally that schools are seeing their pupils return in a very deconditioned state. Even visually they can tell that obesity levels have risen." Harriet Pickering also commented saying, "As life's pace has picked up, people have neglected their exercise and health." This data was obtained from Public Health England's Public Health Profiles. Indicators of physical activity levels. According to data from 2018 to 19 Sport England Active Lives adult and children surveys, less than half of children and young people in Castle Point and Rochford are doing an average of 60 minutes or more activity every day across the week. Approximately a third of children and young people are inactive. This means doing less than 30 minutes a day. 59% of adults in Castle Point and 63% in Rochford are classed as active. This means doing 150 minutes or more activity each week. 30% of adults in Castle Point and 22% in Rochford are doing less than 30 minutes of activity each day. Participation in the Daily Mile. 8 out of 25 or 32% of schools in Castle Point and 14 out of 24 or 58% of schools in Rochford are taking part in the Daily Mile. This is the data as of July 2020, supplied by Active Essex. Comparisons within different age groups. Compared to the November 2017 to 18 survey, the percentage of physically active 16 to 34-year-olds has decreased from 85.9% to 60% in Castle Point and from 83.4% to 65.5% in Rochford. Also, fewer adults aged 55 to 74 are physically active in Castle Point than in Rochford. Emma Colby commented on this saying, "As professional people, it is more about keeping people engaged in physical activity, as the intention always seems to be there." Changes in activity levels since COVID-19. Insight from the State of Life survey. State of Life does not purport to be strictly representative of the whole Essex population. State of Life was an online survey distributed via social media designed to gather key insights on well-being across Essex. Key findings from the survey's first 2 weeks, commencing 13th of April and week commencing the 20th of April 2020, showed that a higher proportion of Essex residents reported being physically active at 59.5% and a lower proportion reported being physically inactive at 24% compared to pre-COVID-19 baseline levels, which was 47.4% and 29.3% respectively. This equates to an increase in the average number of days doing 30 minutes of physical exercise from 3.8 days to 4.1 days. However, the proportion who reported being physically active decreased over the first 2 weeks of the survey from 62.2% week commencing the 13th of April to 55.5% week commencing the 20th of April. This data was extracted from the Essex County Council State of Life Survey Initial Highlights Report. Prevalence of long-term conditions. Quality Outcome Framework, also known as QOF prevalence, is the estimated proportion of all those registered at GP surgeries with a diagnosis. It tells us how common certain conditions are in a particular area. Diabetes QOF prevalence for people aged 17 plus is given for the Castle Point and Rochford CCG area combined. Prevalence of hypertension, coronary heart disease, stroke and dementia is fairly similar in Castle Point and Rochford, although hypertension is slightly higher in Castle Point at 18.07% than Rochford at 16.13%, and dementia is slightly higher in Rochford at 1.04% than in Castle Point at 0.77%. The QOF prevalence of all conditions is higher than the Essex and England averages for each. These figures were obtained from the JSNA 2019 profiles. Emergency hospital admissions. The number of emergency hospital admissions due to hip fractures, stroke and coronary heart disease are fairly similar in Castle Point and Rochford, but emergency hospital admissions due to chronic obstructive pulmonary disease are much higher in Castle Point than in Rochford. In Castle Point there are 102 compared to 81.6 in Rochford. The emergency admission ratio for COPD in Castle Point is 102 and in Rochford is 81.6. The emergency admission ratio for CHD in Castle Point is 84.7 and in Rochford is 90.5. The emergency admission ratio for hip fractures in Castle Point is 104.5 and in Rochford is 101.9. The emergency admission ratio for strokes in Castle Point is 102 and in Rochford is 105.7. These numbers are the standardised admission ratios. This is defined as the ratio of the observed number of admissions in an area to the number expected if the area had the same age-specific rate as England. These figures were obtained from the JSNA 2019 profiles. Falls and hip fractures. Castle Point and Rochford had the second and third highest rates of emergency hospital admissions due to falls in people aged 65 and over across Essex. The age standardised rate of admissions is 2,362.11 in Castle Point and 2,258.51 in Rochford. Both are higher than the rates across Essex at 2,059.46 and England at 2,170.43. Castle Point, Rochford and Basildon were the only districts in Essex with a higher rate than England. The rates of emergency hospital admissions due to hip fractures among people aged over 65 years in Castle Point at 588.79 and Rochford at 607.61 are both lower than the rate across Essex at 611.9 as a whole, but higher than England at 577.76. Figures quoted are age standardised rates of emergency hospital admissions due to falls and hip fractures. Values given are per 100,000 population. The 2017 to 18 data was taken from the hospital episode statistics. Dawn Emberson commented on these figures saying, "If we are thinking about priorities, what can we do with this particular age group of 65 to 79 to make sure that they're not having an increase in hospital admissions by the time that they are 80? Strength and balance work for that age group could be really important." Musculoskeletal health. According to the 2019 JSNA profiles, 39.3% of residents in Castle Point and 36.8% in Rochford report having a long-term musculoskeletal problem. These are both higher than the average for Essex at 34.9% and England at 33.5%. Similarly, 15.3% of residents in Castle Point and 13.4% in Rochford report having arthritis or a long-term joint problem, which are also higher than the figures for England at 12.2% and Essex at 12.6%. On the contrary, the QOF prevalence of patients aged 50 plus with a recorded diagnosis of osteoporosis in Castle Point and Rochford is lower than the national average of 0.62% and the Essex average of 0.39%. The prevalence in Castle Point at 0.26% was the lowest level in Essex. The prevalence in Rochford is 0.29%. Vaccinatable diseases. Castle Point has the highest incident rate of measles in the county with 11.13 per 100,000 people. This is worse than England average of 1.74 per 100,000 people, and the only area classed as significantly worse than England. Rochford has the highest incident rate of mumps in Essex with 3.5 per 100,000 people. This is higher than Essex, which is 1.1 per 100,000 people. This data was taken from the 2019 JSNA profiles. Emma Colby commented on this saying, "The health visitor does assess each family individually and they can see if the immunisation is not done and will question the family. It will be interesting to see what general feedback people are giving health visitors. Parents are challenged, so they would be able to give you a narrative around the thinking." Dawn Emberson also commented saying, "Maybe we start to think about what that means. Is that to do with signposting? Is it to do with social media campaigns? Is it to do with a lack of understanding or education around these things in those areas? If there are opportunities to welcome parents to face-to-face groups or social media groups, for example, to give information on some of the medical standpoints, can we engage those groups with any other messaging?" Other factors to acknowledge are wider determinants of health and health inequalities, for example, built and natural environment, work, vulnerability, income, crime, education, and skills. Family and lifestyle, deprivation data, which will be summarised on the next slide. Barriers that may present challenges but also opportunities. Assets within Castle Point and Rochford, and direct and indirect effects of COVID-19. Dawn Emberson commented on this saying, "It might allow us to do some much more targeted work where some of those underrepresented groups would be willing to work with us on something specific that really suits their needs." Levels of deprivation within Castle Point. According to Essex County Council's Indices of Multiple Deprivation 2019 report, Castle Point is ranked 4th out of 12 in the county for overall deprivation. 8.7% of the total Castle Point population live in the most deprived 20% of areas. Of the 10 most deprived lower layer super output areas, known as LSOAs, in Castle Point, 9 are located on Canvey. A lower layer super output area is a geographic area with a population of around 1,500 people. Levels of deprivation within Rochford. According to Essex County Council's Indices of Multiple Deprivation 2019 report, Rochford is in the upper 10% of least deprived lower tier local authorities nationally and is ranked as 10th out of 12 in the county for overall deprivation. Over half of the Rochford population live in the 20% least deprived areas nationally. This is significantly higher than the average of Essex, which is 25.6%, and is the highest level in Essex. 1.8% of the total population of Rochford live in the most 20% deprived of areas. Rochford has no lower layer super output areas in decile 1, the most deprived, but has one LSOA in decile 2. Next steps. Is there other data you can share to provide more insight? What other actions are necessary to tackle the issues identified in terms of early intervention and prevention? Who else needs to be involved? We will meet before the December board meeting to continue discussion and thinking and develop the draft narrative around this priority for the new strategy. In this discussion, Dawn Emberson commented that the data tells us where we have some real disparity between Castle Point and Rochford. Emma Colby commented saying, "The data reflects what we have noticed from our calls." She also commented saying, "Food banks were probably quite a good opportunity to introduce fruit and veg, but there are challenges around that with storage." Harriet Pickering commented on this saying, "That could be a really good action if we could make it affordable for families. Where more families will be struggling financially from COVID, getting access to vegetables and that being available could be a good thing for all age groups." She also commented saying, "Information collated from the Essex Child and Family Wellbeing Service hubs, health visitors and school nurses might add real strength to the Start Well child and young people focus to bring in some of that data and enrich the Health and Wellbeing Board. The key themes for this discussion are community spirit and isolation."